we're delivering drug and alcohol services, and that's fine, and we do it well, and we get people into the office and we get people talking about drug and alcohol. We don't want to have to label mental health services. We want to have to label drug and alcohol services. That's fine, that's recognised. If you go to mental health services, you go in a completely different picture. And that's our concern.
Yeah, but that shouldn't change.
Yeah. As long as that doesn't change.
And a service delivery, if you like, individual customer, consumer-facing point, that shouldn't change.
Okay.
And there's no need for it to change. What we'll need to do over time is identify where we need to join up those services, because that's the whole point. But that's going to take some time to work through and identify what is the best way to deal with co-occurring issues. But as service providers, there should be absolutely no change. Once the Act is proclaimed, so once it comes into force, it will have the effect of abolishing the current authority and its board, and it will set up, instead of the current status of the board, it will set up an advisory council, which is very similar to what we have in the Mental Health Commission. So its job will be to provide advice to the merged entity on drug and alcohol issues. The CEO of the Mental Health Commission will be the employer of all staff, so it's the employing authority. And the current responsibilities of DAO will be transferred to the CEO, so the Commissioner. Yep.
Sorry, just back before you move on to the difference between the ADA board as it is and the advisory board. What will that mean in terms of decision making? What will that mean in terms of the level of control to make things happen as quickly as possible?
The decision making will sit with the merged entity and its CEO. So the decision making will sit with the Mental Health Commissioner.
So not with the Minister as such?
Yeah. So there's delegations between the Minister and the Commissioner, but the now what will be called the Advisory Council won't have decision making authority. It's purely advisory.
Those functions that were there as part of the original Act have been maintained in this new bill, so they are still there, where previously the board of the authority had the obligation to fulfil those functions. They're now vested in the CEO of the new organisation, so they still have to be done, but it's not the board that then has the final decision-making capacity, as the CEO's got that decision-making capacity.
So how do we ensure that our consumers and our services still maintain a fair share of the pie? Well, an even bigger share of the pie would be nice, but yeah.
Oh, we just needed a much bigger pie.
Exactly.
Transparency is critical, and in that regard, the money that flows to drug and alcohol will be separately identified in the budget papers. So you'll be able to see from year to year the increase, hopefully, that is being appropriated to drug and alcohol. And if anyone does try and rate it, it should be perfectly transparent. That's one of the things we've been looking at is giving appropriate weightings to regional and remote services, and particularly in the costing process as well, so that we actually recognise that there is a significant differential. And there's also implications for models of service. And while we'd all love to provide an equivalent service in all regional and remote places, logistically and realistically, it can't always be the case. The plan should go to Cabinet. We're targeting mid-October for them to have an awareness of what the plan is saying and what the modelling is telling us. And then following Cabinet's noting of what the modelling and the plan is saying, we will open it up to full consultation somewhere between 4 to 6 weeks. But if it takes a couple of weeks longer, then that's fine, because I want everyone to own the plan. Because this is our plan. This is not Mental Health Commission's plan, this is not DAO's plan, this is our plan. So I expect you will rip it apart, but I also then expect you will bolt it back together. There are 3 time horizons in the plan. So there are a suite of actions that are recommended for implementation by the end of 2017. Then there's another chunk by the end of 2020, and then the remainder by 2025. To enable the implementation of those 2017 actions, we actually need to be feeding those into the budget process that will commence early in the new year. That means we have to have business cases developed pretty much by mid-November. And the message in the modelling for both drug and alcohol services and mental health services is basically the population growth over the next 10 years, we will keep pace with fairly reasonably, but it's catching up on the underinvestment of the last 20 that we've got to do. And the numbers draw that out really starkly. And here it is. So if I move from left to right, the Assistant Commissioner Purchasing, Performance and Service Development will be a mixture of current DAO functions and Mental Health Commission functions, particularly in the procurement space and sector development space. The first box there is health, relationship and purchasing. We spend about, I don't know, 500-600 million a year on purchasing services from Department of Health and the area health services. So we need to invest in that relationship and the monitoring and reporting of what's going on there. So that is currently operating in the Mental Health Commission as a dedicated directorate. The next area is where there will be a lot of coming together of DAO and Mental Health Commission in the non-government service provider space. My perspective on the reporting requirements is that it should be pretty seamless and easy for you to upload the information. We should be very clear about the information we need, not the information we can think of, and make sure that we're hassling you for stuff that really counts, not just hassling. Evaluation is in there as well, obviously because it's a fairly data-focused area, but it's also important to separate out evaluation from policy and delivery. And certainly in the Commission at the moment, there's a bit of blurring of that, which in my view means evaluation is compromised because it's being governed by people who own the policy and delivery. Similarly, engagement and consultation is separated out to ensure that we actually have a dedicated focus on basically listening and relationships and making sure that we're engaging with people in a systematic way, in a way that's repeatable, in a way that you understand and value, and also in a way that you know what to expect out of our engagement and consultation. Policy and planning we will bring together in one spot. The planning, once we get the 10-year plan sorted, the planning function will really be to update and keep that current and reflect on where we're at and where we need to go next. The policy areas we need to ensure that we've got adequate connect on addressing co-occurring issues. That's going to be probably the biggest challenge for us in the next couple of years, I think. We will then have a Deputy Commissioner, Drug, Alcohol and Prevention Services. The reason for having a Deputy Commissioner is in part to have conspicuous, elevated recognition of drug and alcohol in the merged entity. So whatever the name of the merged entity is, there will be a specific area identified for drug and alcohol. and that will pick up governance of prevention services as well, including suicide prevention, because I think there's a lot we can learn from the drug and alcohol space that we can apply to suicide prevention, and it will also deal with the clinical service provision as well. So this is the proposed structure of the NGO purchasing and development area. So we'll have sector and market development, quality and business services, then a separate area for service purchasing. So this first box is really where strong relationships need to happen, where co-production opportunities will be as well. And then there's the more formal services purchasing function, and then specialist NGO programs. So we'll divvy up our existing resource across those three streams. Let's assume that legislation goes through, it's all done and dusted in October. We go live, merged entity 1st of November. We will populate the structure with our existing resource, so we will have processes ready to go to allocate people to the various different roles. From there, we will look at, we'll look very closely at shifting some people around so that we're co-locating those teams. So we've got two sites at the moment. We've got St George's Terrace and Field Street, and then we've got Next Step as well. I don't think we'll shift Next Step. That's fine. But, for example, we need all of the purchasing people in one spot. So whether or not everyone moves into St George's Terrace or everyone moves out to Field Street, we need them all in one spot. Similarly, corporate services will need in one spot as well. Policy and planning will need in one spot. So we'll make some of those physical adjustments short term across both sites if we don't have alternative accommodation likely to proceed within sort of 3 months.
There's two different sectors, two different cultures, both at, within bureaucracy, across the sectors. Just some sort of a change management sort of vision or plan of how you're going to support those, support the collaboration, support the integration really to happen. So,
there's always going to be different cultures. Even within the Mental Health Commission, there's 4 or 5 directorates. There's 3 different cultures in the Mental Health Commission. There's always going to be divergence in the way people do stuff and the way they interact. What we will do very early on in the merged entity is work on what are our core values as a shared entity. How do we do business? How do we involve through consultation and engagement the sectors that we work with? And where, as a merged entity, are we headed? At the end of the day, it's feedback from service providers and service users that's going to tell us whether or not we're doing a good job. So again, consultation and engagement is about making sure we've actually got an eye to that and a process to check. But we won't know for 2 years.